Ben Biao, root branch. This also is one of the arts of being a fine practitioner. And it sounds easy once you learn it, but when you get in clinic or you get on a case, it's actually quite complex. There's gray areas. So Ben Biao being root branch means the patient comes in that day with a chief complaint, and you need to figure out, okay, what am I going to treat today? And that's a Ben Biao question. Diagnosis and all that aside, you have that figured out. You got your patient diagnosed, you figure out their pathogenesis, you know how they got there, you know their etiology, great. Now, what do I treat? Okay, so there's 3 rules to Ben Biao. There is treat root only, there is treat branch only, and there is treat root and branch simultaneously. Those are the main rules. Okay, so if you're going to treat the root only, this means that the branch is either non-existent or very mild. As an example, a patient comes in and they have had fatigue and loose stools and loss of appetite and fatigue after eating and scalloped tongue and a bit of a weak pulse in the earth position, right? We all know, okay, spleen chi deficiency, great. They've had that for, let's say, 10 years. And in the past 2 months, they've noticed a little bit of sinus congestion and a little bit of heaviness in their body and just a mild amount of leukorrhea. It's kind of a side note. It seems to be just starting. So here you're going, okay, great. I know it's a spleen chi deficiency, and I know that some damp's being produced. This answer is spleen chi deficiency with damp. Great. What do I do with this patient today? And let's say they're coming for the fatigue, okay? Do you treat root only, which means tonify the spleen chi? Do you treat branch only, which means resolve or drain damp? You could use a bitter flavor food, right? We talked about that, with warmth, like warm pungent. But anyways, let's not go into that. Or are you going to treat root and branch simultaneously, where you're going to tonify the spleen chi and you're going to drain the damp at the same time? So think about that for a second. Are you thinking root and branch simultaneously? Because I notice that's where most students go. It sounds good, but it's not what you need to do. The key with this one is the damp is very weak and it's not very important in the case and it's just starting. So you want to treat the root in this case. You want to tonify spleen only because you have to sit back and think, if I treat the root only, what will happen with this person? Okay, if I treat tonify the spleen, most likely the damp's going to go away. Why? Because it's barely there in the first place. If there's still a bit of hanging around after their spleen's all tonified up, you can drain it then, but probably not because it's weak. Okay, so that's the question you need to keep in your mind. If I treat X pattern, are they going to get better? So with that one, if you chose to drain damp, you can think, if I drain damp, would they get better? No, they wouldn't. It's not why they're coming, and it's so weak, and what's going to happen, you're actually going to drain their chi because it's important to tonify their chi. All right? Now let's look at it this way. Patient comes in, and they're coming for sinus infections, many sinus infections, and they're always coughing up mucus, and it's a white mucus. This person has very heavy white leukorrhea. They feel very heavy, and they've got a lot of weight on. Okay? And when you look into their history, they have a long history of like fatigue and loose stools and all this kind of stuff. So now, and that's a spleen chi deficiency. You're going, okay, what's the diagnosis? Well, there's a lot of damp. So there's certainly damp, and there's also spleen chi deficiency. So the diagnosis is, you have spleen chi deficiency with damp. But what are you going to treat that day? Are you going to tonify the spleen? Are you going to drain the damp? Or are you going to treat them simultaneously? Well, because I mentioned how severe all the damp is, you could probably treat the branch only for a little bit and just kind of drain that damp out and then tonify the spleen. It really depends on the case how severe they make the branch. If there was just a bunch of damp and phlegm, and then you see also spleen chi deficiency, you would treat them together. But if it was an overwhelming amount of damp, you need to drain the damp a bit first before you can tonify spleen. Otherwise, you'll just kind of tonify the pathogenic factor, which in this case is damp. All right. And so that would take care of me answering root and branch simultaneously. Is it seems like the root and the branch are both equally weighted in the case. They're both equally important. So if I took down the severity of the damp in that last case, with spleen chi deficiency with quite a bit of damp, then we could do them both at the same time. Tonify spleen, drain damp. Tonify spleen, drain damp. And then you could harmonize them that way. And of course, one more thing to remember is an EPI, an emergent situation, always wins out no matter what they're coming for. If they are coming for fatigue and they are bleeding like crazy at period time, you're not just going to tonify their blood and their chi, you're going to work on stop bleeding. Okay? Or if they're vomiting like crazy and they're coming for a yin deficiency, you're going to stop vomiting. You're going to treat the branch before the root if it seems emergent. Or if they're coming for fatigue in general, They have an EPI that day. We all know we can't tonify an EPI. In general, there's a couple exceptions, like someone very weak. You might have to do both. But for the average person, you're just going to be scattering the EPI or clearing the EPI, expelling the EPI, that's the word. And then after that, you can go back to treating their fatigue. Okay, so there's your Biao, root only, branch only, root and branch simultaneously. Please watch this video a few times and understand that area is quite gray in clinic quite often, and even on cases. So your question to yourself is, if I treat X pattern, is their chief complaint going to get better? Unless it's emergent or an EPI.